organized by Unicef as a part of the third APIA conference and Evalfest 2022. We who are working in the development sector and in other social domains have experienced time and again that COVID-19 has enhanced the equity challenge on a colossal scale. As far as the gender equity is concerned, the impact of COVID-19 pandemic is not gender neutral and won't be gender neutral in the post-pandemic time. Hence, the present and future policies and programmatic intervention must be gender transformative or at least gender responsive towards as a step towards achieving gender equality. This panel will focus on understanding how different types of evaluative activities have been used in India, Asia, and globally, both for evidence generation and for safeguarding the rights for women and children during the COVID-19 pandemic. We have an excellent panel of speakers across the globe: Jane from Unicef headquarters, Esther from Unicef South Asia Regional Office, and Korush from UNICEF's East Asia Pacific Regional Office. The session would be chaired by Hyun Hee Ban, Chief Social Policy Monitoring and Evaluation, UNICEF India. Before I hand over to Hyun, let me give a quick introduction. Hyun is overseeing the social policy programs and evidence agenda in India that includes 13 UNICEF state offices, supporting government and partners in the areas of social protection, public financial management, and child-friendly local governance, as well as SDG localization initiatives. She joined UNICEF headquarters in 2003, and her professional experiences spans headquarter and supply division, regional office and field offices, and international NGOs, including in the US, South Sudan, Kenya, Jordan, Myanmar, Denmark, and Switzerland. Prior to India, Hyun has been responsible for leadership and managerial support in social policy, program planning, monitoring, and evaluation areas, as well as other cross-cutting areas. Hyun has an MA in International Trade Policy from Yonsei University in South. Over to you, Hyun.
Thank you so much. Thank you so much for the warm introductions. Privileged and happy to be part of this Community Evaluation Fest and the third APIA conference. I would like to first thank the Asia Pacific Association and the Evaluation Community of India, EQI, for inviting UNICEF to host a panel as part of its APIA conference and Evaluation Fest 2022. We've had excellent partnership with EQI and have greatly benefited from being engaged in previous Evaluation Fests. And I'd like to particularly thank Dr. Rajiv Nandi, Dr. Rajmi Argawal, and the other colleagues who worked tirelessly behind the scenes to make this event a success, including my dear colleagues Maike and Swati, who are part of this event. I think all of you are true conveners, connectors, catalysts, forward-looking priorities within the evaluation sphere. And I think that this network and community of practice is an excellent initiative for us to learn from each other and share our experiences. So for UNICEF, one of our core areas of our work is on humanitarian action, working to reach the most marginalized children and families with life-saving support during emergencies. And evaluations of humanitarian action are important to ensure constant learning and help us improve our interventions for the recently, we had an executive board, and the UNICEF Global Plan for Evaluations for the new strategic plan was highlighted. And there's a strong emphasis on the use of a range of evaluation methods and incorporating a humanitarian lens into all our evaluations, including as well as mainstreaming issues of gender, disability, and other sources of vulnerability and exclusion through evaluation. So I think this session through our speakers from our global regional offices will highlight these critical issues today. However, evaluations during humanitarian and emergency situation presents also unique challenges, requiring alternative designs, approaches to evaluations. For example, populations might be harder to reach, findings and recommendations need to be provided quickly and continuously, I would say, to stay relevant and when implemented, make a real impact on children and women. The COVID pandemic, as you'll agree, has presented a new kind of humanitarian crisis for the world. It's an unprecedented in terms of nature and scale. We had very little available information initially, Unicef, to inform policy and programmatic response to meet the needs of who are the most affected by COVID-19. And majority were children and women. And in order to gauge the impact of the pandemic on women and children, UNICEF offices across the world conducted several different types of adaptive, and I would say agile evaluative activities to inform decision makers, advocate with our governments, our partners on policy, program, and strategy adjustments. So UNICEF invested in what's called real-time evaluations and real-time assessments as a reliable and real-time tool for evidence generation, but also adapt its ongoing evaluations to account for and respond to the crisis situation. Therefore, what is the focus of the panel session today? Very excited to say that we'll hear from UNICEF evaluation experts from South Asia, East Asia, and the Pacific regions, and globally to talk about examples of evaluative activities they led during COVID-19. And we'll look at why it was important and necessary, how they undertook it given the methodological challenges and some of the lessons learned. And before I hand over to the panelists, I wanted to share the example of real-time evaluation for UNICEF India. India, I think it was very relevant because children were among the hardest hit by COVID-19. In India alone, for example, the pandemic affected access to learning to around 286 million children. And we're facing a tremendous learning loss, especially those in rural villages where they didn't have digital education opportunities. And prolonged time out of education also increases children's vulnerability to child labor, physical, emotional, sexual violence, exploitation, and abuse. So when we did the RTE, it was really intended as a real-time learning exercise of our response to COVID-19. And it helped us adjust and improve planning and performance. And we focused on ongoing correction of course correction to ensure that we really respond and we learn to respond for future crises. You'll agree that many have said that COVID-19 is not probably the only pandemic we'll be facing. And there are different kinds of emergencies, including climatic shocks and stresses that have, that many parts of India have faced. So our main objectives of the RT was to assess the relevance, coverage, efficiency, and effectiveness of UNICEF India's COVID-19. We also wanted to identify our challenges and bottlenecks and provide recommendations for, I would say, immediate improvement. In terms of the approach we use, as a typical process, we contracted an external evaluation agency to ensure impartiality and neutrality. And we reviewed programs not only at a national level, but also 5 states, including Maharashtra, Uttar Pradesh, West Bengal, Jharkhand, and Bihar. And it's still ongoing because we did it in a phased approach, and it's an ongoing process through several rounds, including desk reviews and interviews with UNICEF and stakeholders, including government, UN, and CSO and donors. So we are still undergoing this process, but for this particular round, it covered January 2020 to present. There were, however, limitations. Although the RT proved to be a very important means of evidence generation, it did suffer from several limitations involving delays, findings that may not be representative given the scale and complexity and the diversity of India, and social desirability, sampling restrictions, and the lack of a comprehensive monitoring mechanism. So in terms of key learnings, what we picked up and highlighted for us for a future emergency situation was think carefully about depth versus rigor versus timeliness of response. What do you want to sacrifice? Because we can't really do it all in an emergency. Remain very flexible. In an emergency, everything is in flux, you'll agree. recognize the difficulty of the situation, be opportunistic, and do what you can. In order to ensure that the findings are used, we also had to identify internal champions within UNICEF and stakeholders who can ensure that we ensure that the evaluation retains momentum, drive, relevance, and we have to set very clear expectations internally around the scope and limitations with evaluation team around outputs and contents for deliverable. And then what we found was very important is we need to supplement, in addition to the real-time evaluation, other learning efforts like lessons learned review and Fail Fest. So now, without further ado, we have a stellar number of panelists with global, regional, and country experiences on conducting evaluations during emergencies. And I'm very pleased to my colleagues. First, I'll introduce you to Jane Mwangi, who's a senior evaluation specialist in the evaluation office based in our New York headquarters. Jane is a senior evaluation specialist and is a team leader for the humanitarian evaluation portfolio in the UNICEF Global Evaluation Office based in New York. She has 18 years experience in managing humanitarian and development operations, including in planning, monitoring, research, and evaluations. In the evaluation office, she manages corporate and large-scale humanitarian evaluations for UNICEF, and also works closely with the humanitarian UN agencies on interagency joint humanitarian evaluation. And in her presentation, she'll highlight UNICEF's global humanitarian function and how UNICEF was able to repurpose its evaluation function vis-a-vis COVID-19. We also have Esther Kagwa, the Regional Evaluation Advisor for the Regional Office for South Asia. And she's based in Kathmandu. Esther has a monitoring and evaluation expertise with over 20 years experience in research, monitoring, and evaluation. As an advisor, she heads the evaluation unit of the regional office. The unit seeks to provide evidence through evaluations, assessments, and other reviews, and enhances evaluation capacity to UNICEF country offices and other stakeholders. So Esther from South Asia will be sharing an example of a gender real-time evaluation, evaluating UNICEF's integration of gender into COVID-19 response. And then last but not least, we have Kurush Rafi, Regional Evaluation Advisor for the UNICEF East Asia and the Pacific Regional Office based in Bangkok. Kurush has over 35 years of work experience, for which 24 have been with UNICEF, including for the Global Evaluation Office, setting policies and standards on humanitarian evaluation for the organization. His work mainly relates to the area of planning, monitoring, and evaluation. And in his presentation, he'll be highlighting an example of the disability evaluation he conducted, adapting to COVID-19 and ensuring the impact of COVID-19 was captured. So their detailed bio is available in the program booklet. I probably did not just do justice to their very illustrious background, but we'll give more space for their presentation and Q&A. So panelists will cover what was the value of the evaluation, why was it important, what did it result in, and what are the key lessons from the evaluation for UNICEF, as well as for the global and regional evaluation community. So we will have 15 minutes each for the panel members. And after each panel member, please do post your comments into the chat box. Given the tight timing, we may kind of look through the comments and maybe feedback to the panelists to be able to respond back to your questions. So let me, I take the pleasure in first inviting Jane Mwangi to take the virtual floor. So welcome, Jane.
Thank you very much, Hyung Hee. Good morning, good afternoon, good evening, colleagues. Many thanks for giving me this opportunity to be part of this panel. I will not be presenting a specific evaluation, Rather, I'll be talking about how UNICEF evaluation function repurposed itself to respond to the COVID-19 pandemic. Who is sharing the slides? Swati? Next slide, please. Thank you. As noted by our former executive director, children are and were the hidden victims of COVID-19 pandemic. Lockdowns and school closures were affecting their education, mental health, access to basic health services, and raising the risk of exploitation and abuse. For UNICEF, COVID-19 was declared a global emergency, and that meant that its application was not only for specific countries, as usually the case. When we have an emergency, it's usually concentrated in a particular country or in a cluster of countries. But in this particular time, it was global. So all countries or regional offices in one way or another had to respond. And we had to take this into consideration, even when we were thinking about planning for evaluative exercises. Given that evaluative exercises would not only be undertaken in a selected few countries, rather in practically all the countries that UNICEF was working, which was a very different approach that we had never had before. In an operating environment that was rapidly changing with calls for continuous adaptation for programming, the evaluation function needed to continue to contribute to learning and accountability. And we saw an urgent need for in-depth understanding of how countries were responding to the crisis and how we were responding to the issues of children and women to inform leadership decisions. In the case of UNICEF, there was, as a result, an appetite for evaluative results. UNICEF offices had to move quickly to adapt to the changing environments. The unusual remote working modalities and lockdowns meant that typical activities could not be undertaken. For example, engagement with government monitoring. And as a result, UNICEF management at different levels of the organization wanted timely, appropriate evidence for the purposes of oversight and learning. And to meet this rapidly evolving context, they wanted to understand how country offices were implementing their plans, how they were determined, how they were targeting different interventions, whether they were reaching the most vulnerable and marginalized children and women, whether we were adapting to the needs of the populations, partnerships, challenges, and so forth. Both senior management and the executive board encouraged the evaluation function to consider different kinds of evaluative work. We were called upon to be agile and responsive, to draw on innovative tools and approaches that would enable us to generate rapid evidence and disseminate it so that we could use it on a more timely and targeted basis. So for UNICEF, when we were thinking about repurposing, what UNICEF did was to agree that we needed to adapt specifically thinking about the context, but then also very, very importantly, also looking at the programming focus. Next slide. No, go back. Go back one more, sorry. Yeah, yeah, thank you. So what we did, UNICEF, we have a decentralized evaluation function. We have the Global Evaluation Office headquarters, then we have regional office, and then in all the country offices, we do have monitoring and evaluation staff who support evaluation functions. So what we did and what we set out to do was to ensure that the entire evaluation function was aligned. And as a result, we issued some technical guidance and had a lot of conversations internally. And the idea was to ensure that as an organization, we are thinking about how we would generate evidence to ensure that as the needs evolved, then we had evidence that would support planning and accountability. The first technical note was an outline which outlined the implications of COVID-19 crisis for ongoing work of Unicef, and then also highlighted the adjustments that were required at the different levels of the organization so that we could still remain relevant. The note also clarified the role and the evaluation function would play in order to contribute to the organization's emerging evidence needs in relation to the crisis. Next. The second note focused on the approaches and also on the specific issues that we needed to think about, adapting the scope of the evaluation to reflect the context of the implementation, and then also the programmatic focus, and then also thinking about methods and tools that would enable us to get some evidence that would help us to make key decisions for programming for children and women. So we developed and implemented an expanded menu of evaluative products and supported decision making at all stages when evidence is especially vital. We also identified new evidence needs and came up with solutions to implement some of the evaluative activities that were seen to be necessary and urgent to provide Unicef with the relevant evidence. And then, of course, all of us had to work together. HQ, regional offices, and country offices in terms of trying to implement some of these evaluative exercises. Next slide, please. And we came up with very many different evaluative exercises. It was very interesting that in times of crisis, you also become more innovative. You start thinking outside the box, and you also start thinking, how can we really gather some of this data to provide management with the relevant evidence for their day-to-day decision making. Mostly because of the lockdowns and the ban on travel, most of them were virtual and flexible approaches. We used approaches like developmental evaluations, which was like the fly on the wall. We had rapid review and synthesis. We used virtual data collection approaches. We also mined a great deal on secondary data that was already available. We had real-time evaluations and assessments. We had community assessments using telephone polls and so forth. All this was largely for oversight and learning, and it was also at different levels of the organization. We were called, as I said earlier, to be agile and responsive. And as a result, the evaluation function really did come through and ensure that the evaluative processes that were suggested were really agile and would provide the organization with key evidence to make specific decisions. Next. This is really an example of some of the evaluative work that has been undertaken from HQ, regional office, and country offices. And my two colleagues are going to speak more on a few of these. But as I said, we had developmental evaluations, we had real-time assessments and real-time evaluations, we had community rapid assessments. We also repurposed ongoing evaluations and included modules very specific to COVID. So for example, if we had an evaluation which was very specific to social protection and cash transfer, we also included a module on COVID to better understand the implication of COVID on some of these programs. And then also for UNICEF, then we also considered very specific country where specific data collection was also being undertaken. So we had a wide menu of options that was available to the evaluation function at the different levels of the organization. Next, and I think this is my final slide. I must say that there have been a lot of learning along the way, and I think we also continue to learn as an organization and as an evaluation function. And I think for me, what has been very interesting and pivotal is that it has been possible to undertake evaluations and evaluative activities and provide critical evidence for decision making, even during a global epidemic. In some cases, you'd think, okay, during a global epidemic, then it becomes it will not be possible to do all that because we have all these lockdowns. We are not able to travel to the countries. We are not able to even speak to communities. But in reality, we realized that you can be innovative and you'd still be able to generate evidence that was critical for the organization making decisions. We've also learned that evaluative evidence is still critical during global epidemics, and it provides management with timely and appropriate evidence for the purposes of oversight and learning. And I think this is very critical for the evaluation function, that yes, indeed, possibly in some of the emergencies, we may not be seen as a priority, but during COVID, I saw that for UNICEF, we were really considered a critical component of the response because we were providing this evidence that was beyond the regular monitoring. It was evidence that was beyond regular monitoring, that was richer, that would really provide the organization critical cues in regards to how UNICEF was programming for UNICEF and for children and women. New evaluation products and tools enabled the organization to choose from a wide variety of instruments geared towards different needs, including real-time decisions, oversight and learning, and then also addressing new areas that emerged. So that was also a useful learning for us. Another one is that it's okay to undertake not as robust evaluations. I think Jung Hee mentioned that, but to ensure that at least we can provide some timely evidence that would really be used for decision makers. I remember those initial months we were really scratching our heads. What is good enough evidence? Yeah, and as Jung Hee said, at some point you have to weigh and determine what would really be most useful for the organization to make decisions. And then another learning is it's possible to adapt to the changing environments, adjusting ongoing work, identifying new evidence and needs, and then also finding solutions to address them under the current constraints. Yeah. So despite all that, it was important. It is still, we still learned that it was still possible to adapt. And then another learning was that some of the, and this is a specific evaluative exercise that was undertaken by many countries, the real-time assessment. We saw this as an innovative and door opener, and it was an approach that was used by many countries. More than 50 countries in different regions used this approach, and it was really primarily useful for regional offices for their oversight and accountability purposes to have evidence in terms of how UNICEF country offices were programming. So overall, all these innovative ways have really been useful for the organization, and we really want to see how we can still continuously use some of those as the need arise, and then also to ensure that the evaluation function is still relevant and seen to be supporting UNICEF management, top management, the executive board in terms of making critical decisions for children and women. Thank you very much.
Thank you so much, Jane, for the excellent presentation. And we'll be presenting a few questions based on the questions from the chat box and the audience. But in the meantime, we'll go to now Esther Kagwa, our Regional Evaluation Advisor, who will be taking us through an example of a gender RTE and into really looking at the leave no one behind agenda within our evaluations. So let me invite Esther. The floor is yours.
Thank you, Yunyu. Aswati, can you move the slides for me? Okay, so I'm going to be discussing for a few minutes the real-time evaluation of gender that the Unicef Regional Office conducted, as Yunyu said. So the purpose of the real-time evaluation was really to strengthen the gender integration of the COVID-19 UNICEF response. We also wanted to generate evidence and learning, and hopefully as a long-term effort to guide future investments, both in gender in emergencies and investments in gender mainstreaming. So in terms of objectives underlying these purposes, we had 4 main objectives. We wanted to look at the extent to which UNICEF had the operational preparedness. So in a nutshell, did UNICEF country offices in South Asia have the infrastructure to integrate gender and gender effectiveness into the COVID-19 response? We also wanted to assess the extent to which gender had been integrated in the response, and then move one step further to evaluate the extent to which this gender integration was effective. And then finally, to document lessons, good practice, and successful initiatives. So this, next slide. So this was, an evolving process. Can you go to the next slide, please? So this was an evolving process. What I'm going to present today in the 15 minutes and the few slides were given in no way captures the richness of this evaluation. But why was it necessary? And there were many reasons. As all of you recall, earlier on in the pandemic, it was a quite dire situation. So this rationale reflects where we were as we were planning. We all understood, and by the time we planned, we knew that COVID was going to increase the vulnerability of women and girls. Women and girls are usually disadvantaged in employment, access to service. And as the lockdowns continued, we knew that that situation was going to get worse. As we have all seen then and now, there were going to be issues of attending school, and in places where girl attendance is lower in some of our countries, we knew that girls were going to be at an increased disadvantage. There were also anticipated challenges, and we began to see some of those in terms of anticipated increases in maternal mortality, disruption of access to services, and the concerns to which this would affect women and girls. And then there was the unprecedented socio-economic hardship. And we know that many times when there's socio-economic hardship, women and girls tend to suffer more. Moreover, women and girls, they were then and are now at the forefront of any public health crisis, COVID inclusive. They work as nurses, midwives, and they also tend to carry the burden in terms of caring for the sick. So because of these vulnerabilities and the potential that this particular emergency had to increase their vulnerabilities, we felt it important to focus on gender and examine the extent to which gender had been integrated and the extent to which that integration was effective. Next slide, please. Okay, so in terms of the areas of inquiry, we used the 5 actions for gender equality that the UNICEF headquarters developed. And so these were just not for evaluations, but overall at the beginning of the pandemic, UNICEF had laid out 5 different areas that we had to look at when we are trying to ensure gender equality in COVID-19. So care for caregivers was one of those, preparations for increased GBV services, maintaining core health and education services and systems, making sure that our country offices and programming engaged with women and youth rights networks, and also ensuring that gender data was available, analyzed, and actionable. So we used these areas as areas of inquiry as we proceeded and planned the RTE. Next slide, please. So in terms of the approach, this was a collaborative and participatory approach, and it was an iterative process that involved the evaluators sitting in and acting as flies on the wall in meetings. We also had key informant interviews of Unicef, implementing partners, government. We had a perception survey. We had a desk review. And moreover, to make it richer, and to make sure that the evaluators were actually getting the lessons, and that as the data came out, that data was being used on a routine basis. The evaluators would participate in a gender network meetings. So once they found something, or when they were developing a case study, they developed it together with the entity, whether it be an implementing partner or certain members in a country office, wrote it up, and then went back to discuss what the findings were, and then came back and then built on those findings to move the process forward. So that was unique and provided information on a routine basis. So this was a rich set of methodologies that enabled real-time data, but also enabled that the stakeholders were actually involved in this evaluation. Next slide, please. So in addition, you're going to move so that we take out the, so in addition to the 5 areas of action, the diagnostic tool that presents the continuum of gender involvement was also underlying this evaluation. So in all those 5 actions, we wanted to look at to what extent was an intervention, or where did it fit on this continuum? Was it gender discriminatory, gender blind, gender sensitive, gender responsive, gender transformative? So in any case study, in any intervention, that was the continuum that was going to be used. And the ideal, of course, as we know, is that, getting to a place where we can say something is gender transformative and that it tackles the root causes of gender inequality and also addresses power dynamics and structures. So in this iterative process, the goal was to determine the extent to which whatever the response was, to what extent did it move close to being gender transformative. Next slide, please. Okay, so this is a brief summary of the findings. Next slide. I'll just comment because of the limitation of slides. The first set and the first question, which was looking at to what extent was UNICEF prepared to integrate gender. We are not going to present it. We found that, guidance and guidance documents were set. There was some data that was gender disaggregated. Country offices generally understood the guidance, but there was also some limitations. There was some guidance that tended to be sometimes gender blind or even, they didn't meet the par, but the guidance was there. So there was a decent set of infrastructure. So that was the first question. So when we talk about gender integration, the evaluation explored a number of questions, and we are presenting here findings from the perception survey, which was online. And as you can see, when we asked respondents how well their country office responded to the specific needs of female teachers in programming, close to 50% said they had either increased attention to this or had innovated and expanded. We still had about 1/3 that said it was same as before. A similar question was asked regarding GBV, and a majority of respondents had either increased attention or even innovated and expanded, which is what we want to see. Next slide. Similar questions were asked regarding maintaining access to core health services for girls and women. And, more than 50% had either thought they had either increased attention or innovated. And certain examples were given. The evaluation would explore in detail these examples to find out on what continuum they were. So examples of increasing access, for example, included mobile medical trips to islands in Maldives, case management and continuity of e-health to healthcare workers in Nepal. And there were several other examples that were given, and we explored those for more. In regards to maintaining access to education services for girls and women, again, a good chunk of respondents thought they had either increased attention or innovated. And there were some examples also. Some of the ones we highlight here included guidance on distance learning modalities, webinars on leaving no girl behind, and then gender responsive education. So these were some of the programs and interventions that were done in that regard. Next slide. Next slide. So there was also a question, you remember those 5 actions around involving women networks and youth platforms. And again, close more than 60% showed an improvement or an increase, either increased attention or innovated and expanded. And engagement of networks varied. There was, for example, I won't read all of them, but HomeNet South Asia conducted webinars. There was engagement with Scout volunteers, youth groups that involved LGBTs and worked to spread positive messages. So we found that, there was a decent level of involvement, and each of these cases was explored a little bit more, again, to see where it fitted on that continuum from being gender blind to gender transformative. Next slide, please. Okay, so there were so many other findings. In a nutshell, in terms of integration, the general summary was there was effort made. There was a lot, many programs that were gender responsive, but many of the interventions didn't really reach gender transformative. And, as you will see here, part of it was the duration of many of these interventions were short. So what did we learn? We learned that a participatory, co-designed and co-interpreted approach increases the provision and use of findings in real time, because, with every set of interviews, the evaluators would go back to the implementing partner, discuss and mentor, and also mentor the network and provide the findings. We also know, and this was no surprise, we found that a humanitarian crisis such as COVID definitely enhanced and increased the risk that women and girls face. However, one of the key findings was that, we just cannot expect gender transformative programming to happen. We don't move from, gender blindness to gender transformative, yeah? So there needs to be processes, so programs need to be gender responsive, and then we enhance them to gender transformation. And so that is one of the things that we found. And then also gender transformative change is nuanced, it's long-term. Unfortunately, many of the programs in COVID and interventions were short, but it requires a lot. It requires expertise in some cases. There wasn't the sufficient expertise in some cases. Implementing partners were still battling and trying to understand what gender transformative is. And so the other lesson learned was that creating a process that uses examples and working with implementing partners, as this evaluation did, it actually bridges the theory, and practice, and helps people get the capacity and understand how can I move a particular intervention from merely being a gender sensitive to gender transformative. So I want to thank you all, and that's going to be my last slide. Back to you, Yunhee.
Thank you so much, Esther, for this excellent presentation. So we now 6:15, so we have an additional 15 minutes for the next exciting panel around disability programming by our colleague Kurush. And then after 15 minutes, we'll use the next 30 minutes for Q&A and conclusion. So I'm very pleased to invite Kurush to the floor. Over to you, Kurush.
Thank you very much. Really appreciate it. And let me see if I can run the presentation.
Kurosh, we can't see you for some reason. Now we can see you. It's like a magician.
So, so good that you can see me, but that's not important. Can you see the presentation?
Yes. So
Yes.
Over to you.
Okay, thank you very much. So I'm not going to repeat a lot of the information that my colleagues Jane and Esther has presented, and they kind of apply to the evaluations that we did during the time of COVID. What I'm going to discuss with you some of the negative impact of COVID on evaluation activities that we face in the region, and then how we plan to overcome them, then draw your attention to some of the hindrances we had to overcome due to remote data gathering specifically, and you know, all the Zoom and Skypes, and sometimes it really hinders team interaction. And finally, I'm going to give you an example of some of our innovative and good work that, as Hyun-hee said, was focused on our disability evaluation. Okay, so impact of COVID on evaluative activities. So we had to move most of our activities to remote key informant interviews, remote focus group discussions, remote observation. And so it really changed in methodology. And this needed if you want to be successful in this, you need an evaluation team that is an expert, has expertise to use technology to facilitate the interaction. So at the same time, given the COVID dynamics and the rapidly changing situation, we had to rapidly feed back to implementers and decision makers in the field. So not necessarily with respect to the evaluation that I'm going to talk about on disability, but the real-time evaluation that Jane talked about. There were country offices that came back and said, we need to know what's working and what's not working right now. So we had to go and put the survey data together with the desk review, with the Q interviews, and produce country reports for these countries that had a CMT or were taking a deep dive. At times you have to go and do real after action reviews or during action reviews. And these specifically, you have to bring an evaluative component on it. And I can talk about that a little later for you on how we brought in an evaluative component to our during action reviews and after action review. So anyways, analyze the data, and the data gathered rapidly is an important point that, again, you've got to be careful that the evaluation team has the capacity to do this. And there's still important information that needs to be quickly acted upon and feedback the same information that you've noticed, you've gathered to the implementers and decision makers, so we can make real-time assessments is another dimension that we had to really be careful about. And we're producing the initial finding reports, which may be subject to further change, but if they're like we had a major meeting, we call it RMT, Regional Management Team meeting, that all the representatives of the 14 countries get together, and we had to make a presentation to that, although we were in draft stage of the report. And so we were able to come and make a presentation on what is the recommendations from the data gathered and analyzed until that point in time. And again, so the rapid production of a full and complete draft report is important. And then regular and frequent meeting with the decision makers or other pathways of information sharing with decision makers within a rapidly changing context is very important. So you don't want to do all your data gathering analysis and conclusions and come up with maybe ways to overcome the hindrances, which we call in our language recommendations, as you know. And then by the time that you disseminate this information, if it's all out of date, they're useless. So being able to have a direct line with the decision makers and the implementers to rapidly feedback, I think, is very important in pandemic type of situations with rapid changes. Okay, so are you going to go to the next slide? What is happening? This slide we talked about. Okay, so some challenges of remote evaluations, the focus group discussions. The issue is you cannot see the body language of the participants together. And it's very difficult when you're doing remote focus group discussions to observe different group interactions, because actually they're sitting in their own rooms and not interacting much. The key informant interviews and focus group discussions, hard to build a relationship. And if there are evaluators sitting and listening to us, you know that sometimes you need to build a relationship with the decision maker and the implementers to really for them to open up and give you answers to your follow-up questions, especially if there are unsensitive issues. So all of this is really lost during remote evaluative activity. Now, on the evaluation team interaction, some challenges that we may face is that the remote connection of the team together was at times problematic, because they'd be sitting in different countries and not being together, and they were in different time zones. And if some of the team members on the same data that had been gathered, if you have different assessment and different viewpoints, if you are in one country and sitting in one room, it's much easier to discuss it in detail and come up with conclusions. And while if you're sitting in different countries and doing Zoom meetings like we're doing now, it's kind of more different. It's very difficult if there are differences that exist. And then the misunderstandings between the evaluation team and managers, if there comes up, and I'm sure all the managers sitting here have had issues with the evaluation team, so that they have had divergent views. Again, resolving those will become kind of problematic. So the good and innovative data collection that was the evaluation team was able to do was this formative and summative evaluation of Unicef's rights and education and protection. And it had a very detailed focus on disability and how are disabled children able, within the COVID context, to continue their education and the impact on them. So the original team was hired to do on-site evaluations, but due to the COVID situation, they had to change their whole methodology to be able to do it remotely. And this needed a lot of interactions and back and forth to come to agreement on what would be the appropriate methodology to implement a fully remote evaluation with such a intersectoral and multi-sectoral kind of work that we were doing. And one of the important points is that each country that the evaluation team and the evaluation firm had to work in, they found a local research team that could help them do the data gathering and interaction with the local stakeholders. That successful interaction with local stakeholders and getting feedback with them, making sure they engaged in the focus group discussions remotely, making sure they're engaged in workshops is very important. And at times they couldn't find a good local research team. So Unicef had to lead and organize the workshops and focus group discussions and really be involved in the data gathering and validation workshops that were being set up. And especially because this evaluation did outcome harvesting, and I'll talk to you a little about outcome harvesting. It was a really challenge to be able to do this remotely. You needed multiple interactions, you needed to design the workshops properly, and you had to have the right technology to be able to do that. So now one of the important works that this evaluation did was combining the theory of change work that they do it with outcome harvesting. And the boxes, the green box over here tells you the sample that they had on the KIIs and the number of workshops they did and the partners and it also talks about the tools that they use. Now, some of the important points that we learned during this exercise is when you do the theory of change workshops and work, and you do the data collection and the design, that is an important point that you have to bring out the methodology on the outcome harvesting. And based on your document reviews, and especially if you compare the planning document with respect to the annual reports and the midterm reports, if there are additional outcomes that are mentioned in the subsequent reports, you've got to be able to design your data collection to be able to validate that and get confirmation of it. And as you're moving down and you establish new outcome statements, and you are working, again, you're continuing to work on the theory of change, and you're trying to bring those new outcome statements into the outcomes into the theory of change, establishing statements by interacting with stakeholders and saying, okay, this is, we think, one of the outcomes you achieved in addition to what was in your original theory of change, in addition to what was in your planning document. Can you put some statements on it? Can you tell me what you tried to achieve, and are you aware of what was happening at that time? Then when you go to the theory of change testing and reveal where the causal chain breaks down and to try to solidify the theory of change, again, you've got to engage the informants and see the outcomes that you have harvested. Are they fitting properly? Are they fitting properly on the causal chain? And how can you bring it into the theory of change or an alternate theory of change? When you go and analyze and interpret then the data to substantiate and triangulate the outcomes that you have, again, that will feed into your theory of change. And at this time, you might have a new theory of change actually emerging. And you've got to, again, validate that with the stakeholders. Again, substantiation includes to going up to the higher level, to the regional level and global levels, and presenting the new theory of change and see if there's any conflict or if there's agreement at the various level. And finally, when you're writing the harvest report, you've got to say, how did the change happen, for who it happened, what happened, and where happened. So this is the way we mixed the outcome harvesting and the theory of change into the workshops. So I'm going to give you, and after this, on the next slide, a little overview of the outcomes that we assessed and the nature of the harvesting. But just to tell you that for each one of these, we had a confidence in evidence scale. So we've gathered this data from maybe one source only. So we say, yeah, we gathered the data, but we have no confidence in it because we couldn't triangulate. We gathered it from one or two key informant interviews that were sitting in the same office, but then we have some doubt for it. So I'm giving you example. When we go to the key informant interview, actually it had a triangulation with a report that was written by the same key informant interview, we see a little confidence. But then we start becoming confident and very confident in the data if we can triangulate through multiple sources, through surveys from multiple countries, for feedback from multiple countries, and then we give it a high 4 or 5 level on confidence. So these are the outcomes that they were assessed by this evaluation. The number over here you see is number of evidence generation activity that supported this outcome. And over here, it tells you where each one of the countries, I took 3 countries for example for you. This was a multi-country, again, evaluation. So another important and challenging work during COVID. It included the Pacific Islands, included PNG and Vietnam. So for each one of these outcomes that were established, I'm not going to go through it because I think time is pressing. They documented what evidence they found out that supported this outcome, and they gave it a level of confidence rating, as you can see over here. And again, this is the same thing. For example, they said they had 17 hits on this. 9 times was in the Pacific Islands, 4 times in PNG, and 4 times in Vietnam. So if you add 4 and 4, 8 and 9, 17, that's the number of hits they had. But that's not important. It's also important the confidence level that they generated for each one of these findings. So these are the outcomes. I'm not going to go through them. You can look at them when we're distributing this, and also the evaluation is on our external website, and you're welcome to look it up, the REAP evaluation, and you'll see the whole report. And this is an example of the outcome harvesting. This was not in the original theory of change. It was not in the planning documents, but quality inclusive services for children with disabilities and their caregivers integrated in sector plans and adequately resourced was something that they looked at, and they found the confidence level. Now, what are some of the lessons learned from this? So I'm going to go, if you give me permission, catch my breath. Data generation and evidence positions, Unicef was a leader in it. So we got good marks on that for children with disabilities. And early interventions and referral of strategic entry points for future disability inclusion was another area that we hit the target on it. Promising links across health and education sector and community-based child protection. So they were kind enough over here saying that these actually didn't exist, but they were promising links that we had to work on. And action learning key for capacity and partnership building, all these results of dedicated resources to regional specialists is another area. One of the areas that we failed on is the ability to work as partners and having our partners go through the harmonized approach cash transfer process that we have and the tests that we have for OPDs, organization with people with disabilities. They don't live up to all the standards that we have. So it's really difficult for us to do cash transfers and support to them. And what they recommended is we've got to have a different modality except the HACT. If I don't know how many of you are working with the UN and understand what the harmonized approach to cash transfer is. We have to have a different modality in assessing these partners, lowering the bar, so we're able to work with them and support with organizations with persons with disabilities. There we go. Happy to respond to any questions. Back to you.
Great, thank you so much, Kurush, for the excellent presentation. So I've seen some comments trickling in, and we'll try to pick a few and also pose a few questions back to Jane, Esther, and Kurush. Shigeo, just to acknowledge your comment that she commends UNICEF's contribution to OECD DAC COVID-19 Global Evaluation Coalition highlighting gender equity. So thank you for that comment. Pradeep highlighted the point from coming out strongly from Esther's presentation about participatory evaluation. So thank you for that comment. Bijita asking about challenges that evaluators face during the process of real-time data collection. Similar comments from so challenges in data collection. I think Beer also around the fly on the wall approach. What are the challenges? So a lot of questions around asking what are the challenges of remote data collection, remote observation. And I would add the last one around how resource intensive or real-time evaluations. Would you say it was more this time as compared to RTs being done pre-COVID time? So a lot of points related to the challenges of real-time data collection, which I think Kurush have addressed. So Jane, so the first question is to you. You mentioned using a variety of evaluation tools and even good enough or not so robust evaluations during COVID-19. You kind of set the global tone from Unicef. How do you balance depth versus rigor versus timeliness in conducting evaluations in humanitarian settings? We are both in South Sudan, remember? So you will be very good at responding to this question. When do you choose one over the other? Over to you for the first question, Jane. And if you'd like to take a few kind of feedback on those that came from the chat, please go ahead. Over to you. Maybe like 3 minutes.
Thank you very much, Young-hee, and excellent questions, including the ones that I can see here on the chat. And I think that was one of the key issues that we had to grapple with during the entire process of the real-time assessments and evaluations. Yeah, what is good enough evidence? And at that point, we realized that you cannot have it all. Given the lockdowns, we could not undertake traditional evaluations where we speak to government partners, to NGO partners, and also to the communities to a very large extent. But at the same time, we recognized that apart from just hearing UNICEF's views and perspectives, it was important to still capture, to some extent, what the communities are saying about the response, what the communities are saying about the gaps, and also what the communities are saying about the quality of the programs that are being delivered. So we came up with an approach of determining the need to speak to at least a few of these UNICEF partners to get a better comprehensive response of some of the evaluation questions, as opposed to just hearing from UNICEF internally. So for example, we agreed that it would be useful if UNICEF was programming in a particular region in a country. We agreed that it would be useful to speak to a few government officials or even county officials to really get a good perspective in terms of the programming and the needs and so forth. We also agreed that it would be useful to also speak to a few community leaders to the extent possible to also get a sense of how the communities felt about the response and the support that UNICEF and other partners were providing. So what we considered good enough evidence, in a traditional sense, it could actually be seen as evidence that was not very rich, but in reality, for us to make those critical decisions in terms of how to enhance programming, that was felt to be good enough at that point. Yeah, so the context, of course, would vary. In countries where it was possible to work with national consultants and they were able to go to some of those locations, then we got richer evidence. But in other cases, it was really largely more using the telephone and using partners that we already had contacts with to get feedback from communities. And then, of course, the use of the mobile telephony was also very critical to tap to communities as well.
Thank you so much, Jane. And I like that you started with the community feedback. Despite the uncertainties, challenges, it's really important to be inclusive. And your point highlighted a quote that I really like when I was working in South Sudan. This was a quote a post-it that I put on the wall. Start where you are, use what you have, do what you can to generate rapidly as much as evidence as possible for UNICEF to course correct, to be able to reach children better and more children. So thank you for that feedback. Now, turning to Esther, thank you for sharing your experiences of integrating and conducting an evaluation to see how we are integrating gender into our response during the COVID-19 times, and you compared it against the pre-COVID times. So would you agree, disaggregated data during a time any data possible is a challenge? What would you say is a solution moving forward? what do we need to do to focus on if we face such a crisis again in the future in terms of gender disaggregated data when already there's very limited data available? So over to you, Esther.
Thank you, Hyun-hee. I think the solution is institutionalizing disaggregated data before a crisis comes. I know that in Unicef, all through COVID, even during this evaluation, there's been a lot of training. It is hard if you don't disaggregate data before to automatically start when a crisis comes. So institutionalize it. And I think it begins with, for every intervention, training implementing partners to disaggregate and the importance of disaggregating, but also setting in place systems. I think, the first question looked at infrastructure, and data and availability of disaggregated data was one big finding. And so the idea, I think I've gotten disconnected, have I?
No, we can.
Okay, so institutionalizing that and making sure that there's a system for every set of data, and changing the culture of not accepting non-disaggregated data. I think we have to get to that place whereby we are questioning, at every level, as evaluators, as decision makers, when we see data that's not disaggregated, we demand for it to be disaggregated. There will be demands when a crisis hits, perhaps systems that we haven't set in place before. But if we begin institutionalizing these practices before the crisis, I think we'll better be situated to have that disaggregated data, or at least have a system that we can adapt to collect the disaggregated data we need during the emergency.
Esther, thank you so much for that excellent point. I mean, I agree, institutionalization, changing the culture that we can't accept non-disaggregated data. I think we often face challenges not only in gender, but age, geographic location, the most remote locations. So this is a very, very good point, including through capacity building of within the organization. So we need champions. I think the evaluation community here can act as a champion. And I think the tone at the top is also very important. Leadership to challenge and require that all the programs put in systems to have disaggregated data collected and reported on. So thank you for that. So the next question is to Kurush. Could you outline, you talked about your evaluation that looked at the issue of disability, also talked about, so I just wanted to kind of hear from you, what are some of the lessons you learned about adapting the REAP evaluation? What were the successes? Do you think it can be replicated? And was it more challenging because it pertained to children with disabilities? Because this is a big agenda also in the Unicef strategic plan. We highlight programming for children with disabilities. So back to you, Kurush.
Thank you very much. Can you hear me?
Loud and clear.
Okay, cool. Thank you. So I think this kind of also relates to the question that colleagues posed to Esther. And we said, okay, you've got to institutionalize before the emergency hits to be able. But what do we, and Hyun-hee, you gave some good examples that you've got to put it into programs, you've got to have champions. But one of the important things that we also learned on the disability front is to generate data, it costs money, it costs resources, it costs staff time. You have to establish systems that can produce that data, then capture it and send it to decision making. So that's part of the institutionalization. So when we say we've got to institutionalize, one component of that is to dedicate enough resources that even during difficult times when systems break down, like if you wanted to look at the gender dimension of our education response, and children weren't going to school and data wasn't being captured, you will not be able to get that data. You have to look at it as, if I go into a remote education manner, how am I going to gather that gender disaggregated data? And for my case, the data on disabled children that are still able to take advantage of remote education, you need resources, you need innovative approaches, you need champions, as you said, and I think a lot of the other dimensions that you said. So working with program colleagues to be able to ensure that resources, be it human resources, be it technical capacity building or financial resources, are channeled in advance to set up these systems so they can deliver the results. One of the questions I saw that was coming was, is this replicable? Is the experience on the REAP evaluation replicable? Yes, it is replicable if you have the right team. If you get a team that, for example, does not want to interact through computers or will not be able to sit in a 2-hour or 3-hour Zoom call and is used to the old fashion of going to the field and with a pen and paper to gather the data, that will not work. It's not replicable in such instances. But if you get an innovative team that is adaptable, that is willing to change, that is willing to accept new methodologies of gathering data, then yes, it is replicable. We can replicate it. Another important point that we learned is having the team lead, the proper team lead that can challenge the situation and bring the team, the whole team, to adapt to the new environment is of utmost importance. So that team lead is a crucial point that we need to ensure has the necessary technology capacity, understands the technology, is able to do the remote data gathering, and then pass and support his team to do the same with him or her is of utmost importance. Back to you, Hen.
Excellent points, Kurush. I'm going to go to one of the participants' question about wanting to, you talked about how, setting up systems costs money, right? It's resource intensive. What about real-time evaluation? So Bijita asked, how resource intensive are real-time evaluations? Anyone would like to answer this question?
Actually, let me come in quickly on that before we go to other colleagues. The real-time evaluation that we did in our region, we decided because we had to do it quickly, we didn't want to go external, we had to sacrifice some issues. So we've got a lot of pushback on where you're really independent, and we used our own staff. So we used our evaluation staff, multi-country evaluation staff, to do all the data gathering, to do the report writing, and to do the presentation. So that when you have the ability and resources within your organization and the evaluative component to be able to do that, it costs you actually less than evaluations and actually hiring outside. But when you don't, then you have to go to external source.
Hyung-Hae, can I also come in?
Yes, please do. And then additionally, another colleague asked that they want to learn more about how do you conduct remote observations. So if any of the panel members would like to also add on that element, you're welcome to do so. So over to you, Jane.
Okay, thank you very much. And in terms of the real-time assessments and evaluations, obviously, as Kurosh has indicated, depending on the resources you have in your region or in a particular country, then it could be fairly inexpensive or quite expensive. So the experiences that we saw, which was across the board, was that it was still possible to manage these real-time assessments at a fairly low cost because of use of internal staff and also national evaluators to some extent. And then, of course, also using existing data, existing evidence, and then also using mobile phones to reach communities as opposed to traveling to some of those communities. And this brings to another point that I wanted to make, and that is what should be the new normal when we are thinking about evaluations moving forward. And of course, we know that it's likely that we'll have one epidemic or another coming up in future. And this is obviously something that we'll now need to take more systematically in our evaluations, when we are planning evaluations, when we are thinking about epidemics, when we are thinking about climate change and so forth. Some of these topics now need to be more cross-cutting in the evaluations. So they cannot be left, and we cannot continue not evaluating them. And at the same time, we may not necessarily need to have standalone evaluations all the time for these topics, but these are topics that would need to be explored and assessed as part of ongoing evaluations. The other one is, of course, the travel. We have realized that during COVID, it was possible to still undertake remote interviews, including talking to communities on videos and Zoom and so forth, although it was not reliable in all parts of the world where technology is really not up to speed. But given that, it also seems that we'll be using other methods, such as observations, which are going to bring a lot more value added compared to international travel. And then, of course, we've talked about more data collection taking place remotely, using technology, and then, of course, also using national consultants, and then, planning adequately so that we can also have some joint up evaluations with other UN agencies in our case, so that you have joint evaluations as opposed to single evaluations, which would cost a lot more. And then also the burden of evaluations in country offices would subsequently be reduced.
Thank you so much, Jane. So let me give the floor to an opportunity for Esther to speak before we conclude the session and hand it back to Raji. So Jane, Esther, any thoughts?
Yeah, so I want to say it depends. It is true that COVID has taught us a number of things. It is true there's limited travel. And it's also true that perhaps because of COVID, we don't collect redundant data. I mean, if it's real time, you have to focus in. There was a tendency many times to collect data on everything. I think in real time and in COVID, we've learned, let us collect the data that is needed. I will say that, you know, while across the board, perhaps real-time evaluations have tended to be cheaper, there's also a time function. You have a small time period. And for us, in some of our cases, what we tended to do is we've tended to hire more consultants. You know, if you have so many focus groups that you have to do and so many key informant interviews and be able to deliver that data in a timely period, you know, you have to add more consultants, you know. And so what's the balance between number of consultants and consultant days? You know, so it's a compromise. It depends on your scope, but across the whole, it's been cheaper. Somebody asked about the fly on the wall, and in the beginning, it was uncomfortable because everybody, you know, we have this observation effect in evaluation. If you think somebody's observing you, you tend to say the things they want to say. So it began with, you know, people being nervous to talk as the evaluator was there. Eventually, she was in their meetings most of the time. And then they realized that she's co-designing, you know. So once they got a case study that had, you know, perhaps wasn't what they wanted, then they began to engage with her more and correcting. So and then it also depends on the evaluator. I'll say that the evaluator we used, Dr. Zaveri, was a, you know, very experienced gender expert, and she knew the methods well. So it depends on the person, but there, you know, you can make it as light, you know, you disarm people, and across time it evolves. Yeah, so that was the experience with this particular evaluation with a fly on the wall methodology.
Thank you so much. So we only have 4 minutes to conclude this panel today. Let me just give a quick recap. So Jane, our senior evaluation specialist in New York, highlighted that leadership at the top and tone at the top matters, because UNICEF headquarters set the direction to encourage offices to conduct RTEs and RTAs during the COVID-19 time. And I was impressed to learn that more than 50 countries across the globe actually simultaneously conducted a RTE around COVID, and it was contextualized to specific regions. She highlighted the importance of agile and innovative ways to ensure timely evidence to provide decision makers key information. And I think Kurush highlighted this, the direct link from evaluation findings to key decision makers really makes a difference. And we need to focus on prioritize information. I think Esther highlighted how gender was integrated in the evaluation during the COVID-19 time, and she used a participatory process to provide immediate feedback during the COVID-19 response. I loved how you highlighted that it was co-designed and co-interpreted in real time with partners. And I think this type of inclusive and participatory evaluation is very, and even in emergencies, we can employ such a process. And in EPRO, Kurush highlighted how he used the REAP2 evaluation that focuses on the issues of disability and how we cut across disability issues across our programs in education and child protection. He talked about challenges in terms of using real-time data collection tools, but at the same time, recognizing that this type of real-time approaches aided quick decision-making, oversight, and learning. So I think those are very, very valuable feedback that we will take away from this panel. So let me now hand it over to Rajiv. Just a huge thank you to the participants for the rich comments and feedback, to all the 3 panel members for sharing their valuable experiences and feedback. I want to take away that in all of the examples highlighted by our global evaluation and regional evaluation experts, we can't forget the leave no one behind SDG principle. Everyone talked about inclusive ways of looking at disability, gender, participatory approach. And I think this is something that, as Jane said, even in evaluation, we have to remember no child should be left behind. So thank you for the opportunity, Apia, Ikoi, and let me turn it over to Rajiv. A huge thank you to the organizers for this opportunity for UNICEF to be part of this evaluation community. So over to you, Rajiv, and thank you.
Thank you, Hyun. So before we close this session formally, let me thank you and all speakers and all the participants today for this excellent session. Generally what we see that these session, all 3 presentations were so nicely organized, stitched to each other. The flow was so smooth from one presentation to another presentation, and very happy to see the kind of questions and discussions in the chat box. So it shows that people are listening to it. Actually, a lot of people here, the people who are engaged in the development, in the evaluation, wanted to know what actually the experiences of organizations like UNICEF in doing real-time evaluations in the COVID time. And actually, it was excellent learning for all of us today here to listen from you and to interact with the participants here. So thank you so much, Hyun and Jane and Kurush and Esther for excellent presentations and comments. And so, we want to close the session here today with a prayer for world peace and unity. And so good night and thank you.